The following program is presented by the Hospice Foundation of America and underwritten by the John and Juana Harmon Foundation. Hello, I'm Frank Sesno. Ahead, stories that will move you, inspire you, and prompt a conversation we desperately need to have about death and life. For many, the very word hospice evokes a strong reaction. Whether it is comfort or fear depends on whom you ask. Some think it means giving up. But those who are familiar with this special kind of medical care know hospice is more about living than dying and making every day count. Welcome to Hospice, Something More. In this program, we'll explain what hospice is and is not. These are the stories of actual hospice patients, families, and caregivers. We'll hear from them and we'll talk to them. We'll experience why hospice is something more.
Ready?
It's a brilliant Saturday morning, and a youth football scrimmage is just getting underway. On the sideline, 44-year-old Karen Jones stands watching her son Michael. She's joined by her husband Bill and her younger son Mitchell, as well as a nanny and a good friend. If it weren't for the oxygen tube she's wearing, you'd never know that Karen was ill, much less that she has stage 4 lung cancer. And you'd never realize that this is Karen Jones in hospice.
I thought, my gosh, that's the end. Like, I'll go into some bed in some facility and, that'll be it. And it's been completely different, and it's been so helpful.
Karen and Bill met in the early 1990s while working together for the government.
And it was one of those deals where you met this beautiful girl, and she was talented and hardworking, and I fell in love with her right from the start.
There was a spark there that was very cute. Actually, I made dinner, and he did the dishes. So I was like, wow, that would be a good catch.
They married in 1996. 2 sons soon followed. Life was good.
And then about 3 years ago, while she was training up for a marathon, Karen started to have problems breathing.
When I was running, I just couldn't breathe.
They treated her for a variety of different illnesses.
I was told, I had sinusitis,
Acid reflux.
I also got strep throat twice, which I never got from the kids, ever.
One thing led to another, and she was finally able to run the marathon, and with some steroids to help with her breathing, she finished the marathon.
I was so happy to have finished it. And then here it comes where now I can't breathe when I'm laying down.
We ended up going over to the emergency room, and they took an x-ray and said, well, she can't breathe because her chest is full of fluids.
It was Ash Wednesday, I'll never forget it. And they drained 3 liters off my right lung. So that's what it was, pushing up when I was running.
Karen had finished running her first marathon with stage 4 lung cancer.
When Karen was first diagnosed, she was in the hospital, I was at home. So she was alone when they came in and told her.
He came in, got in a chair, moved her close, and goes, well, we got the test back, and it's cancer.
And, it was pretty devastating.
I told him, and he broke down.
I got through the visit and went home, and I came to the house, and I put the boys to bed. I went out in the backyard and threw myself on the ground and prayed.
And I was telling him, I'm like, we're going to do everything we can, to really try to beat this and seek out and put everything in God's hands.
And try they did, from the NIH in Bethesda to Sloan Kettering in New York to Mass General in Boston and Johns Hopkins in Baltimore. Karen went through one chemotherapy regimen after another, but her cancer was a rare form, and there was no protocol for treating it. Chemo might work for a few months, but the cancer always returned.
I mean, you get tired. Like, it's poison. These toxins that are going into your body, you know, they could kill you sometimes instead of making you better.
After almost 3 years of grueling treatments, Karen had run out of options. Her cancer was terminal.
And we finally came to that unfortunate time where the doctor said, there's nothing more that we can do for you. You know, we can't treat this cancer. There's no effective treatment. Your body is not able to continue to take these treatments because they impact your system.
I was told, look, you know, we don't have anything else for you. May want to try hospice and just, you know, think about how you want to live your life. And I just kind of looked at him and I'm like, okay. I didn't want to do hospice. I was scared of it immensely.
When the idea first came up, Karen was very against it. And I've tried to be supportive. And so you know, if you don't want hospice, you don't want hospice.
Karen returned home. She wasn't doing well.
When she came out of that hospital stay, she was really worn down and tired and suffering from the symptoms that this disease has brought on, you know, significant symptoms.
I had swelling in my legs and I had difficulty walking because there was so much swelling.
But what happened was I started to get fatigued. You know, I'm trying to work a full-time job, trying to take care of the kids, participate in their activities, trying to take care of my wife, who was still in a recovery mode and needed, you know, medicine every 2 hours or every 4 hours, needed help with, you know, activities to just function during the day. And it very soon became apparent to me that despite my best efforts, I wasn't going to be able to keep up, and I was failing.
So I was going to the bathroom or trying to get to the bathroom, and I fell and hit the door.
One day the priest was visiting, we were up talking to her while she was in bed, and she was in the no hospice mode. And I started to cry, and I said, then you're gonna have to go somewhere because I can't take care of you. If you won't accept the help, then I'm done. And I had never said that, you know, ever. But it was there. I'd reached my limit.
And that's when Bill's like, that's enough, you know. We don't look at hospice as a bad thing. I need help. You need help.
She looked at me and realized that I was, you know, very serious. And she said, okay, well, let's try them. But we won't call them hospice. We'll call them personal care people. I said, okay. So we called the personal care people, and they came out.
One of those people is Dr. Hank Wilner, Chief Medical Officer of Holy Cross Hospice. He's part of a team of caregivers that also includes a nurse, a social worker, grief counselors, and a home health aide.
Hi, Karen.
Hi, Dr. Wellner. How are you doing?
Great to see you.
Good,
I'm
nice
well.
to see
I'm well,
you.
thank you.
Like your tie.
Thank you very much. You look terrific.
Thank you. Feeling good.
And if it weren't for the oxygen, nobody would know you were sick.
Who would know? I know,
It's
really.
great. It's really great.
So, Joyce.
It's been over a month since Dr. Wilner first started seeing Karen.
She was virtually bedridden when I met her, in a moderate amount of pain, with a lot of fluid retention.
Hospice is meant for people whose life expectancy is 6 months or less. The goal of the hospice team was to relieve Karen's pain and treat her symptoms. The effect was dramatic.
It was night and day. You could see her just right away start to do better. She got on different medicines. The swelling and some of these symptomatic problems she had started to clear up. She felt better. She had more energy. And it was just this beautiful progression.
Through adjusting her medications and encouragement and allowing her to follow her own instincts, she has now amazingly become ambulatory with oxygen. She's driving her car. She's contemplating walking in a 10K road race because she was a marathoner. And she has regained a level of function that's just amazing. And she's remained confident, positive, and upbeat through it all.
In hospice, treatment comes to Karen, allowing her to conserve energy for herself and her family.
Well, hospice, it was like you go somewhere to go to hospice to die. I never thought of them coming into your house to help you. So it was very actually convenient to have the nurse's aide come, to have the nurse come to you, to have the doctor come to you. I mean, it was incredibly helpful.
Blood pressure 100/70, temperature 97.8, respiration's a tad bit high.
Okay.
But
The beauty of hospice is that it provides us with the resources we need to live our lives here at home. And the benefit to that is that my wife is able to be here every day to interact with the kids, to interact with me, to take on the activities that she wants to take on. And hospice, with the doctors and the nurses and the caregivers during the day, and if you need them at night, put you in a position, put the patient in a position to maximize whatever energy level they have. And it tends to have a positive impact on the patient.
It does give you hope when you feel better. And when you have the help that you need and the support, and makes your life easier, it brings you comfort to know that you have those services there to really help you. It's getting tremendously better as far as my mobility. Dr. Wellner gave me permission to drive short distances, which was incredible. I was so happy. I could go to 9:10 Mass in the morning, go to the market, take the kids on an errand if they needed. I took a walk last week with my husband. I had the portable oxygen, but we walked down the street, and I'm going to continue to do that. So that gives me a lot of satisfaction and happiness.
Really? Is that a daddy story?
Hospice care isn't going to cure Karen's cancer, but it will give her the best possible quality of life in the time she has remaining.
We've seen Karen make strides that they never would have projected. But I can tell you every day, to see her improve, to see able to participate in the activities with the boys, to be able to interact with my wife, I mean, it's priceless.
And joining me now is Samara Beckwith, President and CEO of Hope Healthcare Services based in Fort Myers, Florida. Samara, priceless is the word he used. What an incredible story of hope and perseverance and courage. We should say there is no cure for the cancer she's got, and we all understand that. But the idea of feeling better with hospice care, is that a common experience, and how's that happen?
It really is very common. In fact, what we have found is that people live better their remaining days, whether it be weeks, months, maybe even a year. Actually, many people do live longer because they do have hospice care now.
So it's the care that hospice is delivering that makes that happen?
It really is the care, because when we relieve pain and symptoms and improve the quality of life, many people do live longer.
We heard Karen say something a moment ago which I thought was really fascinating. Her initial impression of hospice was that it was a bed, it was a facility, the implication a place to go to die. You're saying something very different.
Absolutely. In fact, the vast majority of hospice care is actually provided in a person's home or maybe their family member's home. And that is because people want to be at home for as long as possible, and the hospice team, the medical equipment, the supplies, the medication can all be provided in the home, and that's what makes hospice very special.
So why do people fear hospice?
People believe that when you accept hospice care, that means that you have days or maybe only weeks left to live, that it's about dying. However, hospice care is really about living as fully as possible every day that you have remaining, and to help have more quality of life in every single day, to look at what we can do. Do you want to go to your son's football game? Those kinds of things. We can't cure your illness, we can't cure the disease.
And
However,
you're not there to do that. You're not there to be, you're not curative. You're not.
No, we're not curative. However, we're about care and comfort and quality.
So Samara, when in the course of an illness should someone go into hospice?
Well, usually earlier than they do.
Really?
Absolutely.
So you think people wait too long?
People
They could be getting more out of it earlier.
Mm-hmm.
How early?
Yes.
How do they
well,
know?
But when there's a very good chance that the illness won't be cured, and the fact that the person needs help with pain and symptoms and maybe even talking to the children, that's the time to at least talk to hospice about what's available and how they can help.
Samara, who pays for this?
Hospice is covered by Medicare, Medicaid, and because it really does make a difference for people in terms of quality of life and quality of care, most insurance companies now cover hospice care.
So this is not something that most people are going to have to dig deep into their pockets to pay for personally?
No, it actually is an opportunity to relieve the financial burden because hospice is now covering medication, supplies, equipment, the staff coming out to the house. And that's why it's even more important that they have hospice care earlier than later.
Thanks, Samara. We'll talk to you again later in the program.
Thank you.
Well, selecting hospice care is a big decision for patients and their families, but it isn't the only decision they're likely to face. For one thing, once someone is in hospice, they often face choices they didn't expect about what they want to do in their remaining time, whether additional medical treatments are appropriate, and even whether to leave hospice care to pursue a clinical trial. Some patients actually get discharged if their condition stabilizes or improves. Let's meet several patients now and their families who've been grappling with these issues. In the suburbs of Washington, D.C., Michael Smith and his wife Nancy were living a happy life.
We met at American University our freshman year. We're college sweethearts and dated through college and got married in 1984. It was very nice because when you marry somebody who's really your best friend, we just had a really fun time.
They started a family, a daughter, Rachel, and twin sons, David and Will.
In 2006, that spring and summer, Michael knew something wasn't right, and they couldn't find it. And finally, they found the tumor, which was diagnosed as colorectal cancer. He was 45 at the time.
The twins were in 7th grade. Rachel was a senior in high school. Michael began treatment, radiation, surgery, then chemotherapy. The family hoped for the best, but after a year and a half, the cancer returned.
And the chemo started again, everything started up again. And at some point, he was done. He wasn't done living, but the chemo wasn't giving the results they wanted. They were trying a lot of things and nothing was changing it, but it was kind of ruining his quality of life. And so he decided to stop and kind of go to palliative care. So hospice came into our lives.
Michael decided to focus on getting the most out of his remaining days. His doctor helped him realize what counted.
She was really, really helpful in judging quality of life and really was the person who worked hard to get him to stop working. Sorry. And she was the one who really worked on him about the time he had left and how to use that and what did that energy need to go for, and was work where that energy needed to go.
Michael saved what little energy he had for his bucket list, things he wanted to do for his family.
When my dad was sick, he set out specific goals, and some included like attending my sister's graduation at Allegheny College in Pennsylvania. I mean, it was great that he got to do that. And then he made a conscious effort to go to the beach with us the last year, which was important. And then the most important ones to me was he told us that he would make every single football game. And yeah, I mean, that kind of just like got me through a lot. Because like I could always count on him being there each week. Even my brother's all-star game at the end of the year when it was like 30 degrees snowing, he was there. And I remember him saying I did it. And I was like, yeah, I couldn't believe it. Like I was, and not just us, like the whole community like saw this and wow, he didn't miss a game. That was just like, he cared that much, and that was like really special for me.
Karen Jones also wants to get the most from her remaining days, but she still wonders if she should continue to seek a cure. During his visit, hospice doctor Hank Wilner addresses the issue.
I was thinking about your questions about whether to continue or try to discover other ways to affect your cancer.
Okay, I would be interested.
And I still came back to thinking that I hope you preserve the quality of life you have.
Yes.
And that you not disrupt it unless you're convinced that there is something out there that will provide you with a high chance of benefit and very low burden.
Yes.
Okay? Because your quality of life is really pretty high. And we love seeing that. That's our hope for you, and that's our goal. And we hate to see anything disrupt it.
I agree. For clinical trials, I'm doing so well that I'm hesitant to do one without Dr. Wilner's blessing because, it could really damage me. I've seen it where it could be the opposite. You get some side effect. You read the side effects, very possible. It could be the end and not helpful.
I may ask them, would you prefer to live shorter time more comfortably, or would you risk abandoning the comfort in the hopes of living longer?
And that decision would be very hard to make because you want something to give you a full cure. I just don't know if I'll ever get that.
So I will come back to see you in about a month.
Yep.
Some people do leave hospice to receive additional treatment for their symptoms. Verna Can lives with her daughter, Linda Gorham. Verna's a creative woman. She makes quilts, works with clay, paints, draws, including the illustrations for a children's book written by her granddaughter. She's even shot and edited her own documentaries. Now 80, she suffers from congestive heart failure.
They told my daughter that I had 6 months to live.
It could be 3 months, could be 6 months, it could, and her voice kind of trailed off. So I knew then it was serious.
So I came home and got ready to curl up in the bed, draw up my feet in my fetal position and die.
The doctor was extremely concerned. Mom's condition had worsened to the point that she was going to recommend hospice.
So Verna entered hospice 1 year ago.
I know I'm going to die, I said to myself. I don't have to do it right this minute.
Over the course of that year, though, she's left hospice twice.
When the nurse came, she examined my mother and said, she is really sick and she's having a lot of difficulty breathing. I asked the nurse about a couple of procedures that I thought would help her. She said that they were limited in what they could do, but if I felt that I wanted those procedures, she would recommend that I withdraw from hospice and have her transported to the hospital. And she actually had some papers with her. We did it right then. She also helped me get my mother in a car, and I took her to the hospital. While she was there, with the treatment that she received, her suffering was alleviated and her condition improved dramatically.
And all of a sudden, the people give me the medicine and I started living. I celebrated my 80th birthday in the hospital.
When she finished her treatment, Verna was eligible to return to hospice.
She was readmitted and given additional support when she came home. And that made a big difference in her quality of life.
Now she's leaving hospice again, not because she's in need of emergency care, but because she's been too healthy.
My mother was on hospice care for a year, and we received notice